Just a small disclaimer. This one can get a little personal. So if you're a man listening to this one in particular, I would suggest maybe listening to it you're alone yourself. Just a little heads up because we're going to get a little deep and private into prostate cancer. This is another one we got to get rid of, and we got to learn some things about it so that we can cure it. This is a cure space. This is Charmaine Santier, and we are here with Lottoriddles Institute of Health Research to get rid of these illnesses. If you've watched any of my previous cancer videos or podcasts, you probably already have an idea as to how to get rid of this, and you would be right if I'm guessing correctly. And so let's jump on into it because, we got to get rid of this one. All right. I am just going to come out and say it. This is a homosexual disease. This is a gay disease. This illness is transferred sexually. So this is man on man. All right. From if my theory is correct, this is definitely homosexual. This is another parasite. We got a parasite. We got a bug. Now with this bug flows through the male's semen, the fluid that carries the sperm. It can be filled with parasites, all right? So you got a parasite or a bug that flows through the male's semen along with the sperm. I say that because let's be adult here. A lot of people feel like if there's no risk of getting pregnant, then they can have unprotected sex. And so what's happening, you have a lot of homosexual men, they're having sex unprotected. And what happens is a lot of men, their semen has parasites. These parasites, they get into the prostate. So you have a parasite. Now these parasites can be dead. But what happens is your body has a hard time getting rid of the corpse, the shell of the parasite. Just like a lot of my other cancer videos, like the breast cancer. You have bugs in the prostate that your body is trying to get rid of the shell, and it can't do that. That's causing an interaction that's a negative interaction. It's causing things to grow abnormally. So the short of it is there needs to be prostate surgery to remove the bug's shell, the bug's body, to rid the man of prostate cancer. The problem with that is this is yet another parasite that does not show up on the X-ray scans. So you're going to have to go in the back of them. You're going to have to do exploratory search. Well, you're going to have to search for that corpse that's in his prostate and take it out. That's how you get rid of it. All right. You have to go in, find where that shell is because it's not going to show up on the radar. This is how they can get away with it and remove it. Then you can cure them of prostate cancer. Now, I'm trying to keep it PG here, you know what I'm saying? Because this is theoretical to remind you, but I know some people are going to continue unprotected. And you just want to be clean and honestly, you want to be less rough. A lot of people I can imagine, they go rough and you increasing the chances of getting parasites in an unpleasant, unwanted area about how hard some of these people go. Now, okay, I gotta stop. I gotta. Hey, look, I'm just trying to be real about it. All right, and look, go on Amazon or something and get you like some parasite cleanse tablets. It's like $20-$30. Pop them. They come in like capsules. I think it's like the walnut or what is it? Pumpkin seed, wormwood. I'm probably messing it up. Get some of that and make sure you take that every now and then to cleanse yourself out. All right. Yeah, just look up intestinal cleanse. It's wormwood, walnut. You'll see it. You'll know what I'm talking about. And that helps clean out a lot of the parasites in your body and stuff. I take those every now and then. I always keep some on me. But yeah, you'll want to do that just to make sure you limit, especially if you eating stuff like sushi. It's recommended that you take capsules, or they got the liquid too, right after like sushi. So you keep, parasites out your body. I'm not sure if it's a specific parasite. It may be. I'll update if I have to. All right. With some of these parasites, the person can even be allergic to them. You can have an allergic reaction. Yeah, it gets crazy. Along with all of the symptoms of prostate cancer. You just want to be careful out there. Now, with that being said, I gotta take a shot at corporate America. They gotta get this work. It just appeared very evil and sinister that they know this cure. We know that. If you listen to this, you pretty much know that. They try to get men to do prostate exams. That's a scam. All right. And they try to change a man's sexuality. You don't need a prostate exam to see if you got prostate cancer. All right. They know that if they were to touch and fiddle with your prostate, that's like a gateway to homosexuality. If you play, I want to use that term a little loose. Look, if you play with a male's prostate, some of them, through a chain of events, they gonna turn their sexuality. Some of them won't be able to resist that urge, that feeling. And see, this is what the corporations are banking on. You have a medical excuse to touch one of their man areas and you turn them out. That's what they're doing. You literally can test for prostate cancer with urine. You can do urine tests. They're going to find any and every way to try to take a shot at your life, whether it's trying to change your sexuality. Look, you don't need a finger in the back of you to test whether you have the cancer or not. They're trying to turn men out. Some men, ever since their prostate exam, they've been, massaging, we'll say. So it's keen. It's important to know that trap that lies ahead of you if you're worried about your prostate. Those companies are trying to turn you out. If there's a negative thing they can pass by you, they're going to try to do that. All right. Now, look, don't get mad at your doctors. A lot of doctors are good people. They don't know this. All they know is what they've been taught. The doctor is the wrong person. It's the corporations. All right. There's many other ways. In fact, I would never get a prostate exam. Request the urine. They're going to try to say, oh, that's not, accurate. No, you go with that and you go from there. Do not do prostate exams. I'm against that. They trying to turn you out. So while men are on the examination table getting humiliated, because that's what it is, they're humiliating them. There are a bunch of powerful people in a conference table laughing. You should know that. That's what they do. All right, let's recap. There's a parasite in the prostate. You need surgery to take it out. This parasite corpse, the shell, does not appear on the radar scans. And that parasite can be very, very tiny, microscopic. So the doctor has to dig in and find it. These parasites are transferred sexually through a man's semen. It is a homosexual disease again. So men, you want to wrap it up if you engage in that. And honestly, you want to be less rough. Rough increases the chance of infection. All right, it is what it is. You do you, but you want to get that taken out, heal up. Something you can add to it just to be safe is you can do you can test for a blood clot. You can do the angiogram just to be on the safe side. Make sure everything well down there. But yeah, it's gonna take surgery. And find that parasite corpse, just like how my other cancer videos show. It's so sinister that the radars don't find it. I can't stress that enough. In some cases, your body can even be allergic to the parasite. All right? You gotta be cautious of this stuff. If you have a partner from a different country, especially I think like Europe, they usually carry different parasites. You got to consider all of that, different regions and areas where people from, they all can bring different parasites. Just to be real with you, be cautious of it. It's that Mediterranean area. Keep a lookout for Mediterranean. Do not fall for the prostate exam guilt trip. I repeat, do not fall for the prostate examination scam. Protect your sexuality. They're trying to turn you out. If you're already homosexual, it's nothing personal, nothing against you. It's just they're always trying to change people instead of just letting them be. Why you have to try to change? Why you have to try to induce something? That's all it is. All right, we're done. I hope that helps. Lottoriddles Institute of Health Research. Come back and see me.